We are surrounded by countless viruses, bacteria, and parasites that are at the ready to attack our body and use its resources to feed themselves, find shelter, and reproduce. Luckily, our body has developed a way to seek and destroy these unwelcome guests through the enforcement of something called the immune system. In today's episode, we'll talk about how our immune system responds to these intruders, and as always, we'll connect this topic back to SARS-CoV-2 and HIV. This is Mahtab, and this is episode 3 of the Going Viral series, which is sponsored by the Center for Blood Research at UBC. And with that, let's get to it. So, our immune system is made of two main components, the innate and adaptive system. Let's briefly talk about how the innate immune system works first. This component is made of defense systems that can be activated immediately against a pathogen. A pathogen is any intruder that's foreign to our body. HIV and the coronavirus would be considered pathogens, for example. Things like our skin, hair, and mucus act as a barrier to prevent pathogens from entering our body and are considered a part of our innate immune system. Beyond this, our innate immune system is composed of many different cells called phagocytes, who constantly patrol the body, screening the blood, tissues, and organs for pathogens that may have managed to bypass the initial physical barriers. As they patrol the body, these cells consume intruders, and by doing so, they recognize traces on their surfaces called antigens. They then relay this information to the adaptive immune system. Okay, so what does the adaptive immune system do with this information? The adaptive immune system uses the information from the innate response to mount a strategic attack. That's why it's called adaptive. It changes depending on the type of pathogen that attacks us. In that sense, they act as a special forces unit as opposed to a regular patrol. This allows the body to fight off the intruder in a more specific way, but this takes time to plan out. When receiving information from the innate immune system, special cells called lymphocytes get activated. A group of lymphocytes called T cells search for cells infected by a pathogen and kill them off. Another type of lymphocyte called B cells uses information from antigens to create weapons called antibodies. If you remember, last episode we asked what an antibody is. Antibodies are special proteins that are released in the millions to allow for these intruders to be destroyed. Antigen and antibody sound similar, but antigens are proteins that are found on the pathogen, whereas antibodies are made by B cells to bind to these antigens to help get rid of the pathogens. B cells use antibodies as weapons and destroy the pathogen until the worst of the threat is quelled. The adaptive immune system also keeps a file on these different intruders, so it can provide long-lasting protection from recurring infections. The specifics of an antigen from a pathogen are memorized, so the B and T cells know how to fight back in the case of a reinfection. All right, let's look at how SARS-CoV-2 enters our body and how the immune system responds to it. As you may know, when someone with the coronavirus coughs or sneezes, the virus can travel through the air via little droplets that we can breathe in or get from touching surfaces and then touching our face. The virus enters the body through the mouth, nose, and eyes. The virus then spreads to the back of the nasal passage and attempts to get through physical barriers, such as mucous membranes which line our throat. As it enters the body and begins to replicate, it gets recognized as a pathogen by phagocytes that patrol the body. Once one of these patrol cells recognizes the intruder, it alerts the rest of the body by releasing alarm molecules, which help recruit many more immune cells to the site of infection. These patrol cells also ingest the virus to relay news of the infection to the adaptive immune response, to begin training them to mount a strategic response against this virus. In some people, the action taken by the patrol cells are enough to get rid of the virus, which might be why some people have very mild symptoms or no symptoms at all. If the innate cells are not able to completely fend off the virus, it will continue to replicate and spread deeper into the body. With all this activity going on, this is typically the point during which you may experience something like a sore throat or maybe a cough, and sometimes you might experience shortness of breath. If not stopped early on, the coronavirus can affect many of the organs in the body. As we discussed in the last episode, the virus needs a specific receptor called ACE2 in order to enter cells. The virus accumulates where there are lots of ACE2 receptors, such as in the liver, the kidneys, and the intestine. As it travels further in these places, the body tries to save energy by reducing activity, which is why we may feel tired and sore. Additionally, the body tries fighting the virus by increasing its temperature, which is why we experience a fever. The higher temperature of a fever helps kill the virus, but it also helps the immune system run a bit faster. The organs that are the most significantly affected by the coronavirus, however, are the lungs. So let's look at the lungs in some more detail. As the infection progresses, it eventually reaches the alveoli, which are little sacs in our lungs where oxygen is taken in. In the alveoli, the body continues to fight the virus by causing inflammation. But this can cause damage to these air sacs, making it more difficult for the body to take in oxygen. By this point, multiple days have passed since the start of the infection. The cells of the adaptive immune system have now been trained to formulate a specialized response against the coronavirus. These specialized cells include B cells and two types of T cells. The CD4 T cell, also called the T helper cell, functions like a radio operator and communicates with other cells to coordinate the specialized attack. These CD4 T cells guide another type of T cell, the CD8 T cell, towards the site of infection, where they kill the cells infected by the virus. The CD4 T cell also guides the B cell, which is responsible for making antibodies, the special weapons that specifically bind to the virus in order to help eliminate it. All of this action takes a toll on the alveoli, causing significant damage. This leads to difficulty in breathing and increased coughing and chest pain. If the infection gets worse, the lungs may start filling with fluids, pus, and dead cells. This is when certain people require something called a ventilator to help them breathe. In some, the damage to the lungs is so severe that the ventilator does not help at all, and many times the damage can lead to death. Another symptom that isn't seen as commonly is blood clotting, and this is where our blood turns into this sort of gel-like state. Usually, the transformation of our blood into this gel is normal when we get a cut and we want to stop the bleeding. But with the coronavirus infection, the clots can start forming in different places in our body. This, coupled with the lack of oxygen, can cause various organs to stop working altogether. Alright, we just looked at how the immune response looks like for the coronavirus. Let's look at HIV now. HIV infects our body in a different way compared to the coronavirus. It infects the body by direct entry of blood or other bodily fluids like semen, breast milk, vaginal fluids, and rectal fluids that are infected with HIV into the bloodstream. We'll talk about transmission a little more in episode 5, but let's see what happens when HIV makes its way into our bloodstream. If you remember from last episode, HIV binds to receptors called CD4 receptors, which are found on the surface of these CD4 T cells. By binding to these receptors, our CD4 T cells get infected by HIV. Our innate immune system does manage to fight off some of these viruses, which leads to symptoms like soreness, fatigue, and a fever. But our innate immune system cannot typically fight off these viruses without the help of the adaptive immune system, and some viral particles can get away and roam freely. When HIV infects CD4 T cells, it uses their machinery to make many new copies of the virus, causing the cells to swell and burst. These newly made viral particles find other nearby CD4 T cells and begin the same process of infecting them. As more and more cells get infected by HIV, the body begins losing many CD4 T cells. Another thing that really damages our immune system is the shrapnel from these bursting cells. The infected cells release molecules that cause swelling in neighboring CD4 T cells. These molecules are what end up destroying a lot of the CD4 T cells that weren't even infected by HIV to begin with. HIV ends up causing widespread destruction to our immune system, particularly to the adaptive immune branch through the loss of CD4 T cells. With all this damage, you can imagine there would be some very serious consequences to our body's ability to fight off HIV and other pathogens for that matter. As we talked about with the coronavirus, our CD4 T cells act as radio operators and guide CD8 T cells to kill the virus. They also work with the B cells to make antibodies, which are crucial for getting rid of the virus from our body. But when it comes to HIV, our B cells and CD4 T cells enter a state of disarray because there aren't enough CD4 T cells to guide them. In a way, the radio operators can no longer do their job. And because of this, the B cells and CD8 T cells cannot carry out their regular tasks to kill the virus. That's also where the name immunodeficiency from HIV makes sense. The virus manages to create a state where our immune system is deficient. Deficient means having less of something, and in the case of HIV, it causes there to be fewer immune cells to fight off the virus. And what does this cause? You might remember this slide from earlier on. I mentioned how our immune system is what gives us the ability to prevent these pathogens from entering our body. With HIV, however, the body can no longer fight off these intruders, which it normally would. We also have things like bacteria that naturally live in our body, which are actually beneficial for us. But without the immune system, even they can start growing in number, which puts things out of balance in our body. Our body becomes vulnerable to pathogens from the outside and inside. This leads to what's called AIDS, which stands for the Acquired Immunodeficiency Syndrome. With AIDS, these pathogens can start doing whatever they want at this point, really, and begin using our body as a valuable resource to grow in number. Different intruders might start replicating in different parts of our body, negatively impacting different organs. Our once robust immune system, which would normally have no problem in getting rid of these pathogens, is pretty well near a helpless state. And that is mainly why AIDS is so dangerous. However, it's not all doom and gloom. There are medications and treatments to help prevent a person infected with HIV from reaching the state of a damaged immune system. But the first step in treating is knowing that you have a certain sickness, right? So to help individuals who are trying to fight off things like HIV and the coronavirus, they first need to be tested and screened. So next episode, we will look at how testing and screening is done for both HIV and the coronavirus. And that is a wrap for episode 3. Like I said, we will be talking about the testing and screening methods for coronavirus and HIV next episode. And in anticipation for that episode, I want to leave you with this question. Which of the following is an element that is not looked at when we are testing to see whether someone is infected with HIV or SARS-CoV-2? So one of these options is something that we don't even look at when we're trying to see if someone has one of these viruses. We'll answer this in our next episode. As always, thank you for tuning in. I hope you enjoyed this episode, and we'll see you next week.